Hello, I am Mark Orlando. I am a physical medicine and rehab physician who specializes in interventional spine procedures. I am a physician with Group Health Associates in Cincinnati, Ohio. We have put together this video to help you make decisions as to whether or not these procedures are right for you, and if you've already made a decision to have a procedure done, to kind of show you what to expect during the day of your procedure.
The receptionist will check you in and direct you to the outpatient treatment waiting area. You'll then be taken to the pre-op area to wait for your scheduled procedure. From there, you will be taken to the OR suite for your procedure.
Today we're going to be doing a lumbar facet injection on you. If you will, your facet joints are kind of like little knuckle joints in your back. You usually have one on each side. Classically, people have pain in their back, worse upon awakening in the morning, worse with a lot of extension and rotation activities, and a lot of overhead activities seem to aggravate this problem. Today, after we prep your back, we're going to be injecting 2 joints on the lower left and 2 joints on the lower right to make you feel a lot better. Carol, the injection we're doing today is actually an injection of numbing medicine and steroid. There are also other types of lumbar facet procedures. There's another procedure called a medial branch block. That doesn't have any steroid to treat your pain, just a numbing medicine that kind of blocks your nerve. It's done under a very similar fashion to what we're doing today. Oftentimes we'll do the medial branch blocks, and if those are successful, there's another procedure called radio frequency ablation, which is where they take a metal probe and actually burn the nerve that supplies that arthritic joint or painful joint in your back. We'll talk more about that in the office after your procedure. Good. You're going to feel a little pinprick here on the count of 3, just some numbing medicine, okay? 1, 2, 3. You're just going to feel a little bit of pressure as we could pop down through the different muscle layers in your back. Popped into that first joint. As you pop into the joint, you usually feel a little give way sensation. Now I'm injecting the medicine, which may be pressured, if you will. Some physicians perform this procedure with contrast, which is injecting fluid to make sure they're in the joint. Unfortunately, sometimes that fills up the joint because the joint does not hold that much fluid, and then the medicine won't go in. So if we don't feel it, we will use contrast, but majority of the time we can do it just by feel or popping the needle into the joint. The first joint is done. We're going to move up now and do the second joint. All right, little pinprick here on the count of 3. 1, 2, 3, just some numbing medicine. Coming out of your skin's going to burn. That's the worst part right there. Great job. We're just going down through the muscle layer. Everything looks perfect. You're doing great. We're about to pop into that little joint right now. You might feel pressure or a pop. All right, we're inside that joint. We're going to put in the second dose of medicine on this side, then we'll go over and do the same on the other side, okay? All right, good job. Little pinprick here on the count of 3, just some numbing medicine. 1, 2, 3. Coming out of your skin is going to burn again, Carol. You're doing great. You appear to be in the third joint now. You're doing terrific. Everything looks great. I'm going to be putting some medication in now. A little bit of pressure is what you're probably going to feel. If it's too uncomfortable, you'll let me know and I'll slow down. All right, 1 more to go and we'll be done. All right, another little pinprick here. Count of 3. 1, 2, 3. Coming out of your skin is going to burn a little bit. A little pressure. You're doing a great job as we're guiding that needle to where it needs to be. The last dose of medicine is going in and then we'll be all done. You did great.
Once Dr. Orlando has completed your procedure, you'll be taken to the recovery area where you'll be monitored for approximately 15 minutes, given discharge instructions, and be allowed to leave with your responsible caregiver.